So, all right. So we're all recording now. So what I'm going to do, I just asked if everybody has access to the site of the chronic disease case study site that's under the projects. I mean, it doesn't sound like everybody has access to that, so I'll make sure that I add that on there so that everybody's able to view and see, and I'll go into that, and everybody will be able to understand kind of what I'm talking about in that problems for me. That's adult 2. There it is. Under the project site, you're going to see this chronic disease case study simulation, and that's where all the materials are housed for all the students who've been working on this project. They have their meeting submissions that we don't really need to worry about with this, but the big thing I want you to see is the chronic disease case study materials. This is where everybody in the senior group has submitted their materials. And for instance, I have provided feedback for, let's just go into Haley's. Here I have provided feedback for her that her case study is set up very similarly to, or most case studies are set up very similar to this, where there's going to have a history of present illness, a diagnosis, and then it goes all the way down through their what their algorithm is going to be. And let me show you that here as well. You should be able to see her information here. But it's set up like there's a history and physical, and this is all the paperwork that the students have created, including various different kinds of ABGs and other lab work that is pertinent to their case study. And I've already provided feedback and written information back to all the students. But they ultimately, and something that's important for us as the faculty team, they're going to have presented progress notes as well as kind of a progression of progress notes in terms of how they want their scenario to play out. And this makes sense when you look at their algorithm. So what they've done is provided a little bit of patient information, and this is more so for us as the faculty team to see how the student wants their disease case to progress. As in, these are the vital signs, what happens whenever the student says certain activities from their observing nurse or their caretaking nurse, and then also breaks it down into where they expect that if students recognize changes in clinical conditions, yes or no, kind of what they expect to happen. And then also they've provided their supply list that all this equipment is going to be available on a standard cart. At least that's the way we did it last year. There's going to be a standard cart where the student goes in and then finds their own stuff that they need, right? Is that still the case and still what you plan to do this year, Lee?
Yeah, when we have that main card in 315 that has almost all of the stuff on here, I could just make sure it's all on there.
Okay. Yeah. So all this stuff is available, and they'll pull what they need for their scenario. So as the faculty member, what you're going to do is you're going to be facilitating this case study to move along according to their case progression. Sometimes you might have to deviate a little bit if things aren't being presented quite appropriately or how you need to modify that. But you as a faculty member have the ability to be able to, and actually the intelligence to be able to move that in the way that you feel would be more appropriate based on what's happening in that clinical scenario. So what I have you broken off into each of these groups and the students that you're going to have in those groups with their disease situation and then kind of where they've anticipated that it's going to progress towards. This is all listed on a different Google Sheets doc that I will also give you access to, the Google Sheets, because I was working on that grading their paperwork. But this will give you access to know what the people in your group are going to be talking about. So if you don't quite remember enough about tumor lysis syndrome, then maybe reading a little bit about what tumor lysis syndrome looks like or something like that prior to your simulation. Most of these cases are very very low level. You may have a person who, with the sickle cell disease and acute occlusive crisis, may be that the patient has sickle cell in their history, but then they have a PE or they have something like that. So it's going to be one of those very straightforward, I think, situations that you as the clinical faculty, you're going to be able to work through very easily. Nobody has come out of left field with anything crazy or anything like that so far to this point. But I will give you guys access to this so that you'll be able to see that as well. And then you'll be able to see their chronic diseases of a paperwork that they've turned in. So how this is going to work, at each of those times, like at 11 o'clock, Michaela's going to have Mackenzie and Caitlin as her first group in one room. Michelle, you're going to have Kaylee and KK in another room, and then on down, Rebecca and then Angie from there are going to have these students, and you have about an hour and a half or so to do the two scenarios, have time for them to set up their scenario, walk through their simulation, go through their simulation, and then time for you to debrief and then really hit the highlights and the teaching points of what the students really meant for to happen in that scenario. Now we've paired up the juniors and seniors, and what the juniors are going to do are going to help move the scenario along. Like this patient, Logan's going to present with CHF, complicated by or presenting with pneumonia and CHF, and the junior student is then going to have paperwork that Logan and Kristen have devised over the course of these last couple of months in moving that scenario along. Say, when we get to that decision tree in the algorithm, it may be, does the senior examining nurse recognize when we have pneumonia and say, I wonder what the x-ray looks like. And then the junior will say, well, yes, I have the x-ray report here. Or I wonder, do we have an ABG? And then the junior will say, yes, I have the ABG result as well, depending upon where they need to interact in their scenario. And then you have that time to run through each of those scenarios and make sure you hit the high points of what the disease process is, the big learning points as well. So you as the faculty member are going to have the algorithm, and you're going to be driving the simulation through that algorithm, but also feeding off of what the students are interacting with as well.
Question.
Yes.
So let's just look at Rebecca's students.
Sorry, I didn't realize. Okay. Rebecca's students here. Yep.
So for Rebecca's students in that time frame, so Logan and Kirsten have created a CHF with pneumonia, hypokalemia scenario. Scott and Danielle are going to be the participants in that simulation.
They are.
And then we flip. How does that work?
Yeah, so how that works is Logan is going to be the standardized patient, and Kristen is going to be the person who's kind of helping that standardized patient along in terms of, here's the ABG, here's the x-ray. Scott is going to be the nurse who's coming in assessing Logan in this situation. And Danielle is playing also a student nurse part or a CNA or however they want to set that scenario up, because they've been working together for the last couple of months and playing off of those roles. So Logan's the patient, Kristen's either a friend or something that's helping to progress the scenario, and then Scott and Danielle are assessing Logan in his CHF pneumonia state.
Got it.
That's a good question. And then just like Angie with you and Sarah and Luke, so you're going to have Sarah who's going to come in with hypertension and ultimately has a subarachnoid. Well, Luke is going to need to come in and assess Sarah and pick up on her hypertension and do something about it. If he doesn't do something about it based on the orders that Sarah has, or doesn't go talk to the provider if there are appropriate antihypertensive medications, Sarah's then going to get worse and have acute neurologic changes that Luke's going to have to then assess. Maybe she would go down the route of having respiratory distress because of her acute neurologic decline. So if Luke doesn't pick up on this quickly enough, then things are going to progress more poorly for him through that scenario. They only have about 20, 25 minutes, so a lot's got to happen in that time frame, and they may not even get to the point that Sarah has respiratory distress. But if Luke totally misses the cues and Sarah goes into respiratory distress, well, you, Angie, are then going to be able to talk about what are the cues that he missed, how could we treat hypertension in these patients, what does the acute neurologic changes mean, and then how do we manage the airway in a patient who's acutely had a subarachnoid hemorrhage with bag valve mask and those kind of things.
Greg, that was something that last year, whenever I guess the students have this schedule and such, it's just several of them let the people know, this is how it's going to progress.
Yes.
And this is.
We don't have that this year.
Okay, good.
Yep.
Because
they don't have that this year. What they have this year is, what they do have this year, though, is this junior senior partner list. And you may not be able to see that. Can you see a Word document that popped up or no?
Yes, we can see the Word document.
You can see the Word document. Okay, good. That has the junior senior partners in there.
Well, we see that it's there, so.
Okay, yeah, but it's there. That's lists. Let me. So this then shows all the students who are coming in that 7:30 to 10:30 time frame, but they don't know who they're going to be mixed with.
Ooh, you're the bomb. Thank you.
Yeah, that was some of the feedback that we had last year that, Brooke and Hannah, if they're in the same group, then Hannah told Brooke what her scenario was and Brooke did the same. So they weren't quite, they were prepared for what that scenario was about. But I really want the students this year to come in and say, get a patient in the ED and say, well, we have this hypertensive patient with neurologic changes. What do we need to do? And if they get stuck, they're going to get stuck. They're going to get stuck. What this is not meant to be is to let them sit and flounder and then create such an environment where they have such anxiety, right? You as a faculty member, if you come in and say, Sarah has now had her neurologic changes and Luke is just standing there like deer in the headlights, then there's a lot to talk about, right? There's a lot you have to cover there. So ending it early and not getting to the point that Luke has now had such anxiety about the simulation that he freezes every time he comes into an environment. I don't want that to be the case, but I want to make him sweat a little bit, right? He's going to have to come in and do an appropriate neurologic assessment. And by this point, they should know how to do that. Look at me, smile, squeeze your hands, right? And then go off of that. If that's not working, then if you're not able to move your arms and legs appropriately, then communicating that to the provider becomes another big SBAR component of what is your situation, what's your background assessment and recommendation, and they're going to be all over the place with their SBAR. They always are, and that you're spouting things that's not even important. I have a student who's going to be helping me that day, and we're going to work through some of that SBAR stuff with the students when they come out.
Greg, a couple questions for you. Do you want monitors in the room running?
Yes.
You're going to have a mannequin in each of the rooms then,
Okay.
in order to bounce it off. Are you okay with that?
I am. Just like we did on the back table for each of those.
Yeah. And they can just control. How many rooms do you need?
We're going to need 4 going at any given time. So, oh my God.
So 1, 2.
Are you going to be able to do that?
Do you need? Yeah, I'll figure out something. Do you need recordings of all of these?
No. We don't need any recordings, and 4 rooms with monitors so that we can show the vital signs with each of those. Yes. Mm-hmm.
And you need faculty to be in the control rooms or in workrooms in order to watch them, or you want them in the same room?
We had the iPads last year where they could make changes in the rooms themselves. Angie, Michelle, what do you think about being in the room versus being in the control room? What is your preference?
I like being in the control room because I think that they feel like they're in charge versus us being in there.
Okay. I think that's a good idea. And you like the same thing too, Michelle, right?
Correct.
Yeah. I think
So
that works better when students have the room and they have to go in and kind of figure out what to do, right? And not have the faculty be like, well, go up and listen to them or go up and assess them or something like that. Yeah. Sorry, Lee, you were going to say something there.
I have 3 rooms that are easily remote, and we can have audio and video coming back into the room from 315. A 4th room would be difficult to get the audio feed into that room. So we only have 3 rooms in 315 that are capable of audio and visual together. So the 2 B and D, which are side by side across from each other, that main one we use. And then we have the one where Hal is in the back corner. And then across from that one is there's the exam room. And I could put the bed in there. But that one doesn't have audio coming out of it.
So we could have, I mean, the faculty member could be in that room inside,
So
correct?
as long as if one of the faculty were okay with going in the room, that would work. Now we could, we have a staging room, right? We're going to have them staging in like 320 or something like that.
Mm-hmm.
And we could have a bed in 307 if we wanted to. But again, it's not quite, the audio isn't quite as good in there.
Okay.
I could, if you want, I could put a Zoom link into that one room and you could hear it that way. I mean, that could be possible. I'll need a computer though, someone's laptop.
Yeah. I think whatever way we could make it work to have the faculty member not in the room would be preferable. If for some reason something happens and we have to have a faculty member go in the room, then we have to have a faculty member go in the room.
Okay.
Right.
The only thing I ask, I could do it. I just don't have an extra laptop in order to bring into that room.
Yeah, I'll have my laptop. I can bring.
So also we'll do is when you get in here on Monday, we'll create a Zoom that'll be extended through the whole day.
Okay.
And I'm going to hook up a GoPro to your USB port, and it'll send that feed right into that room, no problem.
I think that works fine. Yeah, perfect.
Yeah.
Perfect. Yeah. I don't feel like, as I said before, I don't feel like we need to record these unless Michelle and Angie, you feel differently. I feel like,
but you have that option when you get in there though. So all of these you'll be able to record just by hitting one button.
Okay.
So if you want to, you can. If you don't, that's fine too.
I don't feel like we really need to, because this really is meant, a lot of these, it really is just meant for, the nurse to be able to interpret a situation, assess the situation, interpret it, and prevent any kind of, significant complications. Right.
May I also suggest too, I remember last year, medications, what we did, because they could be quite extensive, the medications.
Right.
Instead, what I did is I had generic, non-labeled, varying sizes of medication containers that I can just put out there. They can make their own. I have labels if you want it. You think that's good enough?
I think that's good enough, because they're going to have, each scenario is going to have, an hour and a half of time. So they're going to take their 15 or 20 minutes to get set up for their scenario, which does include those medications. Run the scenario for 20 minutes, and then you're going to have another 30, 45 minutes to do debriefing before we switch to the next group.
And this is all starting at 7:30 on Monday,
7:30
right?
on Monday. Mm-hmm.
What time are you guys all getting there? What time are you planning to be there at 7, I guess?
I'm going to be there at least by no later than 7 for sure.
Okay. It'll be good. I'll have everything in the basic structured set up. And once you guys get in here, we'll just knock it out, whatever we have to kind of finalize the.
Sounds good.
I think it'll work.
Perfect.
And the other date is exactly a week later, right?
That is correct.
The only reason why I'm asking is right now, our system's down. The camera system is down in the room. It's not supposed to be a big deal, Also, they need is the college to release a certificate number link, but they're dragging their tails on this thing. And it's all week it's been going on. It should have been done in an hour. So I'm kind of screaming a little bit on making this thing happen.
Sure.
That could be a hang up though. So
it could be a hang
FYI.
up, but I don't feel like we need to worry about that because of recording issues. I mean, we're not.
Yeah, but that may kick you out of that room because even though we don't use the recording, we're still using the feed coming in. I'm hoping it's going to be fine, but I'm just a forewarning that you may have to go into that room if they don't resolve this by next Monday.
Okay. I mean, if that's what we have to do, that's what we have to do, right? I mean,
I'll keep you posted on it though.
I'd like not
I've been screaming about it all week. So they know that it's a high priority for us. Okay. Our lab is shut down. I don't even have access to the calendar right now to give you an idea. So
that's craziness. All right. What questions do you guys have? What other pointers did you remember from last year that I've missed for the people who are going to be watching this recording?
I can't really think of anything. I think you've covered most of it, Greg, and the students get really into it, and it's a wonderful experience. So I can't think of anything at the moment.
All right.
Same here. I can't think of anything, any questions or any further tips or tidbits. Most of the time the students seem very well prepared. Although if you asked my juniors the other day, they have no idea what they're doing, but I'm sure they'll figure it out.
Well, they've had this explained to them multiple times. I've explained it to the seniors multiple times. This is what your junior is going to be doing. And ultimately, if the junior does nothing but stand and observe and learns about what sickle cell disease is, what pneumonia is, what are ABGs that go with pneumonia, and what is lab work, I think we've been successful.
Agree.
What's that?
I said I agree with you.
Yeah, I didn't catch that there. But all right. Well, that's all I have. I'm going to stop recording and then